If you notice persistent joint stiffness lasting more than 30 minutes each morning, your body may be sending an early arthritis warning. Here are 4 other signs doctors say you shouldn't ignore. And staying until the end of this video could help you recognize these patterns and know exactly when to seek medical attention. Arthritis affects over 58 million adults in the United States alone, making it one of the leading causes of disability. But here's what catches most people off guard. The condition often begins with subtle symptoms that get dismissed as normal aging, or the result of overdoing it at the gym. The earlier you recognize these patterns, the better your long-term outcomes. A 2021 study published in Arthritis, Care and Research found that patients who sought treatment within the first 6 months of symptom onset had significantly better functional outcomes compared to those who waited longer. The challenge is that early arthritis symptoms can be subtle and easy to rationalize away. You might think it's just the result of a hard workout, sleeping in an awkward position, or simply getting older. But your body is often trying to tell you something important. Before we dive into the specific signs, I want to clarify something important. This video is for educational purposes and not medical advice. If you're experiencing persistent joint symptoms, you should consult with a healthcare provider who can properly evaluate your individual situation. Now let's look at the 5 warning signs you shouldn't ignore. Early warning sign number 1. Morning stiffness that lasts more than 30 minutes. This is often one of the first signs people notice, but it's also one of the most commonly dismissed. You wake up, your joints feel stiff and tight, and you need some time to get moving. Sound familiar? If you're nodding along, comment stiffness below, so I know this resonates with you. Here's what makes this significant. Occasional stiffness after a night of sleep is normal and usually resolves within a few minutes. But when joint stiffness persists for 30 minutes or longer after waking, it suggests inflammation in your joints. When scientists at Johns Hopkins tracked patterns in early rheumatoid arthritis patients, they discovered that morning stiffness, lasting more than 30 minutes, was present in over 80% of cases before diagnosis. The mechanism involves inflammatory compounds that accumulate in joint fluid overnight while you're inactive. Your body temperature drops slightly during sleep, and this can cause the synovial fluid in your joints to thicken, making movement more difficult. Pay attention to which joints are affected. Arthritis often begins in smaller joints first, like your fingers, wrists, or toes. The stiffness might be symmetrical, affecting the same joints on both sides of your body, which is particularly characteristic of rheumatoid arthritis. Don't just dismiss this as getting older. If you're consistently experiencing prolonged morning stiffness, especially in multiple joints, it's worth discussing with your doctor. Early warning sign number 2. Unexplained joint swelling that comes and goes. Swelling in your joints, even if it's mild and intermittent, deserves attention. This isn't about the temporary puffiness you might see after bumping your knee or overdoing it at the gym. We're talking about swelling that appears without an obvious injury. Joint swelling in arthritis happens because inflammation causes your body to produce excess synovial fluid as a protective response. Think of it like your joints are trying to cushion themselves against the inflammatory process. This excess fluid creates visible swelling and that feeling of tightness or fullness in the joint. The tricky part is that early arthritis swelling often fluctuates. You might notice it more in the evening after a day of activity, or it might appear for a few days and then seem to disappear. This on and off pattern can make it easy to convince yourself it's nothing serious. Data from the National Arthritis Foundation indicates that joint swelling, even when intermittent, is present in approximately 70% of people during the early stages of inflammatory arthritis. Location matters here too. Osteoarthritis typically affects weight-bearing joints like your knees, hips, and spine, as well as your hands. Rheumatoid arthritis often starts in smaller joints and tends to be symmetrical. Psoriatic arthritis might affect individual fingers or toes, sometimes causing them to swell like sausages. If you're noticing recurring swelling in your joints, even if it seems to come and go, document when it happens, which joints are affected, and what you were doing beforehand. This information will be valuable when you talk with your healthcare provider. If this information is making sense and you want more evidence-based health content like this, hit that subscribe button. I share new research-backed approaches to health topics every week. Early warning sign number 3. Joint pain that's worse with inactivity. This sign confuses many people because it seems counterintuitive. You might expect that resting your joints would make them feel better, not worse. But with certain types of arthritis, particularly inflammatory arthritis, the opposite is true. If your joints feel more painful and stiff after sitting for extended periods, after a long car ride, or when you first stand up from your desk, this pattern suggests inflammation rather than simple wear and tear. Scientists at the University of Manchester studied movement patterns in arthritis patients and found that inflammatory joint pain typically improves with gentle activity as movement stimulates circulation and helps clear inflammatory mediators from the joint space. Contrast this with osteoarthritis, which often causes pain that worsens with activity and improves with rest. Understanding this difference can provide important clues about what's happening in your body. You might notice this pattern after watching a movie, working at your computer, or even after sleeping. The joints feel locked up and painful, but once you start moving around, the discomfort gradually eases. This is your body telling you that inflammation, not mechanical damage, is the primary issue. Pay attention to this pattern. Does your pain get better or worse with movement? Does rest help or hurt? These details matter for accurate diagnosis and treatment. Early warning sign number 4, symmetrical joint pain or stiffness. Here's where the pattern of your symptoms becomes really important. If you're experiencing similar pain or stiffness in the same joints on both sides of your body, both wrists, both knees, or multiple finger joints on both hands, this symmetry is a significant red flag. You're more than halfway through, and if this information is proving valuable, let me know with a quick comment. Now here's what most people don't realize. The symmetrical pattern is one of the strongest indicators of autoimmune inflammatory arthritis, particularly rheumatoid arthritis. Your immune system doesn't pick favorites. When it mistakenly targets your joint tissues, it typically does so systematically across your body. This creates that mirror image pattern of symptoms. A 2020 analysis in the Journal of Rheumatology confirmed that symmetrical joint involvement is one of the earliest distinguishing features between inflammatory arthritis and osteoarthritis. Osteoarthritis, in contrast, often affects joints asymmetrically. You might have pain in your right knee but not your left, or your dominant hand might be affected more than your non-dominant hand because of usage patterns. The symmetrical presentation suggests something different is happening at a systemic level. This doesn't mean every ache and pain on both sides is arthritis. But if you're noticing a persistent, symmetrical pattern combined with other signs on this list, it's worth having a conversation with your doctor. Take note of whether your symptoms mirror each other. Are both wrists affected? Both ankles? Multiple finger joints on both hands? This pattern provides critical diagnostic information. Early warning sign number 5. Unexplained fatigue that accompanies joint symptoms. This final sign often gets overlooked because fatigue is so common and has countless potential causes. But when persistent tiredness occurs alongside joint pain, stiffness, or swelling, the combination tells a more complete story. Inflammatory arthritis isn't just a joint problem. It's a systemic condition that affects your entire body. The chronic inflammation requires significant energy from your immune system, and the inflammatory compounds circulating in your bloodstream can directly impact your energy levels and even affect your sleep quality. The Arthritis Foundation reports that over 80% of people with rheumatoid arthritis experience fatigue as a major symptom, often appearing even before other signs become obvious. This isn't the normal tiredness you feel after a busy day. It's a deeper exhaustion that doesn't improve much with rest. The fatigue might make it harder to concentrate, reduce your motivation for activities you normally enjoy, create a general feeling of being unwell, even when you can't quite pinpoint why. Combined with joint symptoms, this systemic fatigue strengthens the case for seeking medical evaluation. If you're dealing with both joint issues and unexplained exhaustion, don't treat them as separate problems. They may be connected pieces of the same puzzle. So when should you actually see a doctor? If you're experiencing any combination of these signs that persist for more than 2 weeks, it's time to schedule an appointment. Don't wait for symptoms to become severe or disabling. Early intervention makes a significant difference in long-term outcomes. Your doctor can perform a physical examination, order blood tests to look for inflammation markers and specific antibodies, and potentially refer you for imaging studies. Modern arthritis treatments work best when started early, before significant joint damage occurs. Remember that these signs aren't a diagnosis. They're indicators that warrant professional evaluation. Many conditions can cause similar symptoms, and proper testing is necessary to determine what's actually happening. Comment ready if you're going to pay closer attention to these patterns, or if you're planning to discuss your symptoms with a healthcare provider. And in my next video, I'll reveal the specific questions you should ask your doctor during your first arthritis evaluation that can help ensure you get accurate diagnosis and appropriate care. If this information was helpful, give this video a thumbs up and share it with someone who might benefit. Take care of your joints, and I'll see you in the next video.